Hello everybody. Today I'm going to be demonstrating the X-Tip Intraosseous Anesthetic Delivery System. This is a great tool to have, and it bailed me out countless numbers of times. So I'm going to be showing you 4 cases today, and these cases are all lower teeth. Lower teeth are typically the ones that are more difficult to freeze and require supplemental anesthesia. Now you're going to find lots of tutorials out there, and you're going to find technique cards and instructions on how to do this properly. But I'm going to be sharing my tricks. These are tricks that I've learned in practice, and a lot of them I learned from my partners Mike and Ted. I think they're pretty useful. So the first thing to note is that you should only be using anesthetic without epinephrine. So you want to stick to carbocaine or mepivacaine, something with no epi, and you deliver an entire carpule. You want to make sure that the buccal tissues are numb, so you would use just lidocaine and infiltrate a little bit buccally, or give a long buccal block. And then once you place the X-tip into the handpiece, the first thing I do is I actually separate the sleeve from the X-tip drill. So I just take the little white piece and rip it apart. I find that when it comes from the factory, the two pieces are actually stuck together quite tight. So if you don't do that, you'll end up sometimes it'll jam in the bone. It'll take a lot of force to pull it out. So if you separate the sleeve from the drill, it'll just go a lot easier.
So these are the 4 cases that I'll be showing. The first 2 are both of tooth number 47, and we're going to be using the retromolar pad, or the area where the third molar would have been. This is the ideal spot to anesthetize either a first or second molar. So if there's no wisdom tooth, this is your site. The X-tip passes nice and easily into there, and you can deposit the anesthetic. On the third case, the patient had a wisdom tooth, so we had to pick a site in between tooth number 36 and 37. This also works well, but you really need to find a larger space interproximally. And the last case will be in the premolar region between the 44 and 45. So here I've already given 2 carpules of lidocaine with epinephrine. I did a cold test and the patient still felt it. So we've decided to use the X-tip, and we've picked the retromolar pad as the ideal site. You retract the cheek, and you can use a slow speed handpiece or a endomotor, RPM between 15,000 to 20,000, and that's it. It just dropped right in. So now you can use your mirror to hold the sleeve in place while you pull out the handpiece. You always have to come in at a 45-degree angle from the buccal. This is very important. If you go straight on, you may miss it. You can put a little stopper on the needle if you like. It prevents backflow of the anesthetic, and make sure you hold the suction right next to it, because some of it will leak out and it doesn't taste nice. I'll usually administer an entire carpule at this point. Some people like to leave the sleeve in place while they're working. I'm just a little paranoid. I take it out right away. So as soon as I'm done with the anesthetic, I take it out using a hemostat and a very firm grip. And then I deposit all the sharps in the sharps container right away. Now at this point, I've already given 2 blocks and an X-tip, so I don't need to wait anymore. I can just put the rubber dam on and get going.
Sorry.
If you want to be sure that the patient is numb, you can try placing endo ice on the tooth again. And this time she's good, and we're gonna get started. Here's another lower molar case. We're gonna use the exact same spot. The reason why I chose this is just to emphasize that this retromolar area is ideal. 45-degree angle. And it's through. Use the mirror to hold the sleeve in place, pull out the handpiece. anesthetic. There's a little stopper.
Okay, a little bit of pressure.
Warn the patient. You can warn the patient that they're going to feel it. So they'll feel it underneath their chin. Suction away anything that leaks out. Slowly administer the entire carpule. And we're ready to go. Make sure you have a firm grip on that hemostat when you remove the X-tip. I usually use the second molar as a fulcrum, so I just press down on the second molar and it pops right out. So here's another case. This time we're going to be using the space in between the 6 and the 7. The procedure is the same. It's a little bit trickier, to be honest. It takes a little bit more effort to get through the cortical plate at this site. So just make sure you pick a good spot in between the teeth. 45-degree angle. Okay, and it's through. Same idea, you can hold the sleeve down with the mirror. Now with this technique, you get very profound anesthesia, but it doesn't last very long. You get about 15 minutes to put the rubber dam on and get the pulp out of the tooth real quick, so you can carry on with your case.
Okay, a little bit of pressure here. Jill, can you hold the section next to the...
Make sure you warn the patient, yep. And see, we didn't have the suction and a whole bunch leaked out. Just administering the whole carpule. And I'm going to take out the X-tip right away. And throw it into the sharps container, as well as don't forget to remove the sharp drill from your handpiece. So here's our last case. This time we're going to be using the spot between tooth number 44 and 45. And we're going to be picking a spot in between the teeth at the base of the papilla, and try to imagine coming in at a 45-degree angle right underneath the papilla. Lots of RPM, but gentle apical pressure, gentle pressure. Again, you hold the sleeve. See, that one was a little bit tougher to pull out. So you hold the sleeve down with the mirror and you pull back the handpiece. Administer your carpule of anesthetic. And you can begin. It's a very straightforward technique. A lot of people are intimidated by this, but there's really not a lot to it. You just have to find a good spot. Make sure you've got your angles right, and use lots, high RPM, but very low pressure. And if the first spot you pick doesn't work, then just pick another site. Just remember, retromolar pad. If that doesn't work, then interproximal papilla, base of the papilla, 45-degree angle.